It's a scene from the daily life of this Japanese couple. Taro and Yoshiko have been together for 40 years, but their lives changed forever in 2007 when Yoshiko was diagnosed with advanced dementia. Her husband remembers when he started worrying about her health.
Her actions and words were incoherent. For example, she started eating while standing up, and she would throw food at my face. I was worried because she had never done that before.
Dementia is a progressive decline in brain function and often involves memory loss. Yoshiko's condition is at an advanced stage. Her husband is her round-the-clock carer. He bathes her, makes sure she takes her medication, and goes out of his way to make her smile.
The disease is difficult for us and impacts us both equally. It's not just her who's affected, but me too, as I don't know how to react to her behavior.
Dementia is a growing concern here. With almost 1/3 of the population aged over 64, Japan is a super-aging society. The government has formed a special committee to tackle the dementia crisis. It meets every month and includes officials, patients and their families.
Today we know that anyone can be affected by dementia. Every member of society should be concerned because it will affect us all.
The committee's aim is to include patients in possible solutions. A law passed last year requires improved training for healthcare professionals, a better care infrastructure and more medical research. This woman, who has early-stage dementia, has been raising awareness of the disease for 17 years. She's pleased the government is taking action.
This is an important development, as these measures for dementia management will be introduced throughout Japan. It will raise awareness among the entire population.
Japan has a population of 124 million. Around 4.6 million people live with a form of dementia.
Our society is one of the fastest aging in the world. Many countries have yet to experience our situation. The number of people over 85 is increasing rapidly, so we can become a model for the rest of the world if we find a way to manage the increase in cases.
Ordinary citizens are devising their own measures. This cafe in Tokyo employs 2 people with dementia. The work makes them feel useful, and they say they enjoy it. Toshio Morita has been working here for a year. He takes orders and serves drinks, but he sometimes makes mistakes. His wife, though, has a different take.
When he takes the orders, he has the customers write them themselves. He sometimes forgets, and the supervisors have to go back and take the orders. But he doesn't realize what he's done. He thinks he's doing it properly.
This 86-year-old man works at the cafe for an hour every month.
My husband likes to meet people and stay active. Working here stimulates his memory, and it makes him happy.
Akiko Kanna opened the cafe in 2023. The idea came from her father, who had dementia and was always looking for somewhere he could feel at home. It's a safe space where people with dementia can work and their mistakes are accepted.
They lose the ability to do certain things, but it isn't their fault. They're doing their absolute best. We have to make sure not to interfere or blame them for their mistakes, and instead be kind and accept them as they are.
Japanese drug companies are stepping up their efforts. Some available medications can slow the deterioration of a patient's cognitive function by as much as 27%.
In addition to drug research, we conduct blood tests to detect cases of dementia. We've invested nearly 9 million euros in research and development.
But Japan faces a race against time. Experts predict that almost 6 million people aged 65 or over could be living with dementia by 2050.